Hi, and welcome to a short little episode of Democracy Theater with Rich Scott. As you know, Democracy Theater is kind of over because exposing something that's right out in the open, yeah, that doesn't make much sense, right? But here I am anyway. I have a question for you. Why are you against universal, single-payer health care? I want to know. I need to know. I have to know. What is your argument? Is it morally based? Financially based? What is it? Because here's the situation. As you know, if you've followed me before during the election, I vote on that single issue alone. Well, obviously not. There's some other boxes that need to be checked off, but that is the number one issue for me: universal health care. Why? Because without health, you can't go out and crush it. Without health, you can't go out and do the things that make you a better and more productive citizen. And I like those kind of people. I like happy, healthy, productive citizens. So that's one of the reasons. Why am I bringing it up now? Well, because I just saw the difference again. Remember, I grew up in Denmark, so I have a vast experience with a healthcare system that provides healthcare for all its citizens, and I also got screwed by the American system, even though I had a healthcare insurance, right? I had healthcare insurance. I called the surgeon. I got all the hospital codes for everything needed, provided it to my insurance company. They said, oh yeah, go have it, Mr. Scott, it will be fine. All you're going to have to pay is the $500 deductible that you have. Fine. I think I paid like $235 or something per month for health insurance. Have the surgery, everything is fine. Come home. 3 months later, I think it is, I get a letter in the mail, and I open it up expecting having to write a check for $500, except this one is for $10,000. Yes, that's right, $10,000, unexpected. Now, some of you, $10,000 is what you find in your couch over there, and for some of you, that's more money than you have seen yet. $10,000 at the time when the median income, I believe, was about $56,000, right? So it's a bit of a shock. Also, I had health insurance, right? So I shouldn't have that extra bill. So again, why are you against a universal basic socialized medicine? Ooh, there was the word, socialized medicine, coming to get you. Yeah, how annoying that you can be healthy and you can keep could be active and vibrant human being as long as you live, not based on your socioeconomic status, but on your freaking human being in a civilized society. Yeah, I don't know. But again, my question. So, is it a financial argument that you have? Is it that you believe that it costs more money to have a socialized medicine? Well, you're wrong. Those facts are well out there. Use Google, right? As I sometimes say, back in my snarky days, I would say you can use Google for more than searching for porn, right? You could search for some facts. The nations that we are comparing ourselves with, right, is the OECD nations, right? America, we in the United States, we pay about $9,000 per hospital bed. The average in the OECD is, guess what? $3,000. Our neighbors to the north pay a little over $4,000. Again, financial argument doesn't work. Whoa, but what businesses? Well, let me see. An export business that no longer has to pay for its workers' health care will become more competitive. Will be able to lower its prices. Maybe we have businesses that could lower their prices and will become export businesses. Who knows? But again, doesn't make It doesn't make an argument. There is no financial argument, right? There's the argument of 112 per 100,000 Americans die each and every year because they could not get health care, right? It's another study that says it's between 20 and 45,000 fellow Americans. Forget the universe and the world. Fellow citizens, right? Love the flag, love America. It's Veterans Day today. Is that what they're fighting for? We don't give a shit? Is that it? Okay. Say that. Then be honest in the fucking debate at least, right? Say, yeah, I don't give a shit. Let them die. Let them eat cake. Doesn't matter. I got mine. Fine. That's an argument I can deal. Well, I can't engage because, it doesn't work in a modern civilized society. But at least it's an honest opinion. So it's not. So we pay more. So it's more expensive per bed, our system, compared to any other OECD nation, right? And we're the only OECD nation that does not provide a universal healthcare system of some sort. Some countries have where you can buy supplemental, but all of them, except for the United States, provide some sort of socialized medicine. So we pay more for the beds, right? We have worse outcomes, generally speaking. Yes, we have specialties where we're better at, but in general, our general outcome is worse. As a matter of fact, it's so bad that we're the only nation in OECD that are starting to drop dead quicker. Not sold yet. Still not sold on socialized medicine. Is it the word? Is it the propaganda? Okay. Well, so here's the thing, right? We can't base public policy on my experience, my one experience, right? Or your single experience, or the one fucking story that Fox News, the one, they pull out the one story of the person that died 20 times over somewhere in Canada because they didn't get in on time, right? There is exceptions to every rule. But again, remember, we have 20 to 45,000 Americans that die each year because they couldn't go to a doctor. Not because we can't cure what they had, but simply because they could not go to a doctor. Okay, so worse outcome, we pay more, we have worse outcome, our life expectancy is going down. What is your argument? Why are you against universal basic health care? Waiting list? Here's a story. Again, a person that is on the lower ranks but has health care in America, and somebody in Denmark. Something with their hands, both need surgery. My mother in Denmark, I think, was diagnosed and in and out of surgery in less than a week and a half, 2 weeks. My friend is still not done. Haven't seen, running around, can't get any answers. So, we're inefficient, we pay more, we get less, we die faster. We have fellow Americans that are dying just because they can't get to see a doctor. Again, please tell me, for the love of God, why are you against socialized, I'm going to call it socialized medicine? I don't know. Here's what I do know. Guaranteed you are going to have to see a doctor at some point. Guaranteed you're going to have to be in a hospital at some point. If for nothing else, we're going to have a baby. Right? God willing, it's going to be a fantastic, beautiful, easy birth. Might not be, though. Should you then start, oh, God, damn, what machine how much is that machine? What, another 10 grand? Really? That's what we want people to think about at one of their worst or best times of their lives. Seems silly to me. It seems like something we can change, and it seems like that there are no reasonable argument against it. So I have to ask, why are we still debating this? Why are you still against it? Please tell me. I'm open to hear it. I want to hear it. I can only tell like I said, my own personal story. My quality of life has gone down because I like physical activities that I can't participate in because I can't go get it fixed in America because I could not for a long period of time afford health insurance here. Probably one of the reasons that I was in these dark periods before when I recorded earlier, right? So that's how it ends up. It has consequences beyond just the numbers. But the numbers are good. So tell me, again, I would truly like to know. I would. What is your overriding argument for why we should not have and join the rest of the OECD nations and get universal health care in America? As a matter of fact, if you have a line to Donald Trump and you want him to get reelected and you want them to change the Constitution so that he can get another term, or at least you want to bury the Democrats for the foreseeable future, have Donald Trump propose universal health care in America, or even the public option, and watch the Democrats collapse. Obama failed. Trump believes in it. You should believe in it too. And if you are on his team and you want him to be reelected and you want to crush and exterminate those Democrats, do the right thing. Get us universal health care. Let us join the rest of the civilized world. Let us take care of each other.